As a dentist, has a patient ever lied to you? Last month, I had this elderly woman named Mrs. Caldwell walk into my office clutching her dentures like they were broken glass. She plopped down in my chair and immediately started complaining about how her dentures were shrinking mysteriously and didn't fit anymore. She claimed they were falling out constantly, hurting her gums, and making it impossible to eat anything except soup and pudding. The woman was demanding a brand new set at absolutely no cost, because clearly it was my fault they didn't work. I looked at her current dentures, and they were practically brand new. Not a scratch on them, perfectly clean, no wear marks whatsoever. Something felt completely off about this whole situation. I asked her to show me exactly how she puts them in her mouth, thinking maybe there was a technique issue. She fumbled around with them so badly that they almost fell right into the sink. It was like watching someone try to put on shoes they'd never seen before. Mrs. Caldwell kept insisting that I must have made them wrong the first time, that they were defective, and that she deserved free replacements immediately. She was getting louder and more demanding, saying she'd been wearing dentures for years and knew exactly how they should feel. But every time I asked her specific questions about when they stopped fitting or what exactly felt different, her answers kept changing. A few days later, her daughter Rebecca called my office sounding completely embarrassed. She apologized profusely and then explained the real story behind her mother's mysterious denture problems. Turns out Mrs. Caldwell had been hiding her dentures in a jewelry box for the past 3 months because she didn't want her new boyfriend Frank to know they weren't her real teeth. She'd been going without them completely, eating only soft foods, avoiding smiling too wide, and basically torturing herself to keep up this ridiculous charade. But after months of mushy food and being unable to chew properly, she decided the easiest solution was to blame me and demand free backup dentures. That way she could have one set to wear around Frank and another set for when he wasn't around. Rebecca told me her mother was absolutely mortified that Frank might discover her secret, even though the man was 78 years old and probably had his own dental issues. The whole thing was completely insane, but Mrs. Caldwell had convinced herself this elaborate lie was easier than just being honest with her boyfriend. When Mrs. Caldwell came back for her follow-up appointment, I decided to confront her gently about what her daughter had told me. I explained that I understood wanting to look younger and feel confident, but that her dentures weren't actually the problem here. I told her we could work together to make adjustments, or even design a more natural-looking set if that would help her feel better. At first, she tried to stick to her story about them shrinking and not fitting, but eventually, she broke down and admitted the whole truth about hiding them from Frank. She was actually crying, saying she was terrified he'd leave her if he found out she had false teeth. I felt genuinely sorry for her at that point. I offered to make her a thinner, more realistic-looking set that would be less noticeable and fit more comfortably. We worked together on the design, and I even showed her some techniques for speaking and eating more naturally with them. When she left my office that day, she was actually smiling for the first time since I'd met her.